Health Chat is partnered with Buell Regional Health Foundation.
Eating disorders are very isolating, and people who have eating disorders sometimes tend to be in a hidden space where they need to be reached out. So when we have more awareness and we have education, we can reach the people when they're hurting. What is an eating disorder? So I want to talk about two things. There are clinical eating disorders. So those are diagnosable eating disorders. So that is anorexia, bulimia, ARFID, binge eating disorder. But there's also this whole world of disordered eating, and that are individuals that might be subclinical. They don't necessarily have a clinical diagnosis, but we need to reach them too. We need to kind of look at the global statements that we use and narratives about food and fitness and wellness. Risk factors for eating disorders, there's actually quite a few of them. And I'm just going to throw out that a lot of people are at risk. I think, again, it being hidden, we don't always know who has those risk factors and when they're going to surface. Genetics play a role, for sure. So genetics do matter. Environment, we're in a tough environment with media. We're in a tough environment growing up, even in our schools and our doctor's offices. That has an impact. There are certain personality features, but these are really good personality features. So they're people that are driven and perfectionists and willing to work really hard and bright, beautiful human beings. But that exact trait is the same trait that makes them susceptible. So because the eating disorder needs someone to really dig in and stick with it, it really affects people who are brilliant and fabulous and amazing. So those are some. Trauma can play a role too, but you can see how it can encompass so many people. We like to say that eating disorders are a cognitive and physical hijack. It takes it all. So it's a brain disorder, and that's really important to express. It does come out in the body, it does come out in emotion, but it affects the brain. The brain actually changes. So whenever that happens, you see a person who acts completely different. Their emotional state's totally different. And then we do have physical changes. But true story, less than 6% of people with anorexia or eating disorders show it in their body. So the impact is all over, and it kind of hijacks them for years. It can take a really long time, especially if we don't get in right away. Oftentimes when I talk to clients about warning signs, somebody didn't know what to look for, or somebody said or did the thing that actually kind of surfaced the eating disorder voice. So I think it's really important to know what some of those things can be. So I think that one thing to look for is the difference between obvious and subtle. So if you're a parent or have a loved one and you see they're not eating, that's kind of obvious. They're not eating, maybe their weight is changing. So certainly that is a red flag, and we want to keep an eye on that. But there's also subtle things like choosing different food choices, changing their focus on what they're looking at on social media, how they're changing things they might order at the restaurant. How much are they looking at their bodies? What are they looking at in media? Who are they hanging out with? So it's kind of getting an idea of the full picture of little teeny things that might get missed and often are missed in the beginning. So once someone really starts to have behaviors and maybe they're changing choices they're making with fitness or food intake, it might be way past the time when we could have gone in and helped them. So the first thought, the first moment is a good time to see that risk factor and step in. So I have a saying, recovery starts with one bold new choice. And I'm really going to hit choice because through my clients that recover and have these beautiful storylines, they didn't want to do it. They didn't always feel like it was the right thing. They didn't believe that their team knew, but they chose. They chose to make a step and get help. And that's a really scary step. That's why we're talking, so we can get a little closer and help people with that step. So the first thing is to realize that you need a team. You cannot do this alone. Eating disorders do not get better on their own. And I hate to say that because it's so black and white, but they don't. So you need an interdisciplinary team. That's a bunch of individuals, a nutritionist, a psychiatrist, maybe even a coach. You'll have a therapist. If your symptoms are even stronger, you might have to go into higher level of care. So there's all these different tiers. So the idea is to get a team, start the conversation, potentially with your doctor even, who might be able to help to assess what's going on. And then once that conversation starts, you need to get involved with a team who specializes in eating disorders, like the whole Institute. That's what we do. There's not a lot of us out there. We're also talking because we need more people to go into this and to help and start to get evaluated and assessed as soon as possible so then we can start the recovery path. And it's a long path. It's a tough path. And Grayson's going to talk a lot about that. There's a lot that's involved, but if you start early, if you work with a team, we do see progress. Treatment does work, and you can get better.
My recovery really started in 2021. I have had various levels of care, everywhere from inpatient when I first kind of was forced into the choice, and then along the way, after I was discharged, I got in contact with the Hall Institute, and I have a therapist, I have had a dietitian, I have done intensive outpatient, and I also currently have a peer supporter, which is a very new thing over the last few years. And recovery is like really hard. It's the hardest thing I've ever had to do, but it's worth it. Someone working through recovery, you may not always want to do it, but what I have learned through going through recovery myself is that the continuity of going through every day, even those days where I don't believe that it's going to get better, or I'm feeling doubtful, or I'm just struggling a lot with self-worth, the more that happens, the more I'm going to believe what the new truth will be. The Everybody Fashion Show is an event through the YSU Fashion Show program, and they advocate for eating disorders in remembrance of a student who passed away from bulimia in 2012. And breaking that stigma by showing not only all various bodies, all various people can have an eating disorder, where it's not that black and white, and also all bodies, all various types of people are worth and deserving of showing off themselves, and everyone's deserving of that, having fun with it, and it's a great way to show that eating disorders are all around us, even if we may not notice it.
When I first joined the fashion show in 2021, I was a senior in high school. I just started feeling confident in my body, and that's why I joined the fashion show, just to be able to promote myself and feel good in that situation. And ever since then, it gives me the most confidence I could ever have. Just walking down a single runway for 2 minutes, I get the glory that I need.
So again, eating disorders are everywhere. We actually have seen them grow intensely since 2020. And they're not, because they don't show themselves, we really need to know what to look for. We need to know where the resources are. And I think as a global community, we need to neutralize our language and the way we talk about ourselves, our bodies, what we eat. If we all do this, not only are we gonna not trigger or hurt people who are already struggling, but we're gonna clean up our own internal narratives. And I think that's just gonna make us all a much more mindful and happier human population. So this is, to me, gets even beyond our persons struggling with eating disorders. I'd like to see us all work a little better on this.